Turn this on, you can hear me better. I hope everybody has had a fabulous couple of weeks or whatever, and we're all here together. So we're gonna start, and I'm gonna ask Linda to have a roll call to see if we make one.
Robert Byrd,
Here.
Astrid Hager,
Here.
Yvette Martinez,
Here.
Summer McBride, Frank Ramos,
Here.
Maricela Ramirez.
Here.
Carol Sagala. Julie Taryn.
Here.
Deborah Allen. Deanne Tilton Durfee. Jacqueline McCroskey. And Alejandra Albaran Moses. Quorum is present.
Thank you very much, Linda. For this meeting, we've received a request from Commissioner Martinez to teleconference pursuant to AB 2449's Just Cause for Caregiving Need of a Child. Commissioner Martinez, hello, how are you?
I'm good. Thank you. Thanks for accommodating me.
Please confirm that you are teleconferencing pursuant to AB 2449 for Just Cause due to a caregiving need of a child.
Yes, yes.
That's good. I'm actually into caregiving of children who are in need. That is my job in life. So thank you for that. And before we get into the rest of the agenda, I would like to take a brief moment to introduce two new board members who are recently appointed. Alejandra
Albaran Moses.
Thank you. I was worried about the middle
Worries.
name. From the Policy Roundtable for Child Care and Development, and Julie Taryn, who is the new alternate from Supervisor Horvath's district. We are excited to have you both here. And join in whenever you can and bring us your thoughts and expertise would be amazing. Thank you for that.
Thank you.
I think we can move on to item number 3. Unless there's public comment on these people. No, I'm only jesting, Linda. Review program and planning committee transcript from June 29th, 2023. I have a hard time calling on anybody who's read all of those minutes, but I'm assuming that we can move on from there.
If there are no additions or deletions or changes to the transcript, then we can receive and file the transcripts. And confirming there are no public comments on this item before we move on to item 4.
Thank you very much, Linda. I appreciate that. The next 2 items will be led by our Executive Committee Vice Chair Frank Ramos, since these 2 items fall under this committee's purview.
Thank you, Doc. Thank you, Commissioner Hager, and welcome to the latest and greatest commissioners. Glad to have you here. Item 4 is our annual audit that falls under the purview of both our executive and budget and finance committees. And with that, I'm actually to Hager to present.
And that puppy on. Good afternoon, commissioners, members of the public and staff and our friends on the web out there. Welcome. My presentation today represents the year-end annual comprehensive financial report for fiscal year 22-23. In today's presentation, I will include a brief summary of several items for you today. Those items represent the GFOA award, an overview of the annual comprehensive financial report process, and the outcome of the independent auditor's report. I will also be taking a few minutes to highlight some of the budgeting and accounting activities that transpired through the past fiscal year, as well as provide a trajectory of the organization's fiscal reality by showing you a three-year comparison of our revenues, our expenditures, and different trends that we have been observing. And then at the end of my presentation, I will invite Kanali Sakusiam, our CPA firm partner, to say a few words about our audit, and then I will open it up for some questions and for some comments. Thank you. First, I'd like to start with the GFOA award. The Government Finance Officers Association, also known as GFOA, has awarded First 5 LA the Certificate of Achievement for Excellent in Financial Reporting for its annual comprehensive financial report for the fiscal year ending June 30th, 2022. Even though we are addressing fiscal year 22-23, the report and the certificate does come out during the summer. So it's our opportunity to shine the light of work that we have done in the past. This report has been judged by an impartial panel and represents the highest form of recognition in government accounting, and its attainment reflects a significant accomplishment by the organization and its management. The fiscal year 21-22 certificate does represent the 15th consecutive year that First 5 LA's financial report has received this award. So compliments and congratulations to the entire organization and the team that supports the annual audit process. So moving on to the actual financial report, there are some requirements. As part of the California Health and Safety Code that established First 5 California and county commissions are required to prepare audited financial reports and statements in accordance to generally accepted accounting principles. This consists of basic financial and supplementary statements at the fund level. For First 5 LA, we do step it up a notch. Our report is above the normal reporting requirements set by the California Health and Safety Code and the First 5 California Management Guide. The financial report goes beyond the scope of basic financial statements and state compliance, as well as it reflects a detailed view of the commission's financial position at a moment of time, which for today would be as of June 30th, 2023. Hence, our ability to qualify for the GFOA award. As part of the audit planning and process, it does take several months to complete. There are 3 phases, starting with the interim field work that begins in May and field work that continues through the month of August. And in September, we do finalize the end process in partnership with our auditors in September. The process is an organization-wide effort, which includes interviews with directors and staff, confirmation of pending litigations from our legal counsel, as well as a thorough review of our accounts payable files to assure the appropriate internal controls are in place. And as steward of public funds, commissioners have oversight and must approve this report to be submitted to the State Controller's Office and First 5 California by November 1st, which action to approve is scheduled for the October 12th commission meeting. Now to move on to the actual report. I'm happy to report that the result of the fiscal year 22-23 from our auditors, Eide Bailly LLP, noted that the financial statements are presented fairly in accordance to generally accepted accounting principle. This is an unmodified opinion, which in plain English equates to a clean audit. During Eide Bailly's normal course of performing their assigned function of the audit, no material deficiencies in internal controls were identified. And though no material deficiencies were identified, opportunities to tie in some of our controls were brought to management's attention. One such example of that was identified and addressed through the normal course of the engagement was how we looked at our investment true value adjustment. We share you this information in full transparency. Even though the management letter is not a required document to share with the board members, we as an organization have always looked to transparency and feel like it is appropriate for us to be sharing this level of information to our committee members, specifically the executive committee members and our budget and finance committee members. So moving on from a clean audit, I want to spend some time to just reflect and highlight some of the activities that occurred during fiscal year 22-23. We began the year July 1 of 2022, starting with the approved budget. This budget was approved by the board in June 2022 for a total of $106 million. And through our regular budgeting process in March of 2023, the board approved a revised budget of 104.9. This is an overall decrease of approximately 1.1 million, which was related to several programs that were the budgets were adjusted downward and upwards that netted to a $1.1 million adjustment overall. Moving from our budget and now focusing on our overall revenue, the total revenue for fiscal year 22-23, we received roughly $83.5 million in total revenue, which 47.3 million came from our tobacco tax revenue. First Five LA also received an additional $16.2 million from Proposition 56, which represents the 21-22 fiscal year's backfill, which is consistent from prior year when we received the funds 1 year in arrears. What's new for fiscal year 22-23 is the California electronic cigarette tax, which we booked $1.1 million. That $1.1 million is expected to go up, even though right now we don't have significant data to support the rate of what that $1.1 million may go up. As for other revenues, we received $15.3 million. That $15.3 million really reflects the hard work on how we look at sustainability or looking at opportunities to offset our cost. The total revenue also includes an accounting entry, which is an adjustment to the fair market value of our county pooled investment of total of $3.6 million. On the expenditure side, we saw a total of $91.9 million for fiscal year 22-23. With $73 million related to our program expenditures, which will be highlighted in the report following up my item with the First Five California's report. $6.6 million was related to our program operating expenditures, and the remaining $12.3 million is attributed to our administrative expenditures. All right, now to pivot to what everyone would like to know, and that is how much money do we have left? What is our fund balance? For fiscal year 22-23, our ending fund balance as of June 30th was roughly $275.7 million. The overall fund balance is distributed by certain degrees of constraints aligned with accounting principles and our current fund balance policy. Though I will not be going over these definitions, this slide is to provide context to the degree of the different constraints from highest to lowest, and to remind our commissioners that the distribution is ultimately determined by action that the board has taken, such as budget approval process and other actions that the board has taken throughout the fiscal year. I used this slide in order to really reflect a simpler visual to illustrate and to focus the distribution of the fund balance by the constraint. We start with non-spendable that came in at roughly $485,000. $80.7 million is under the committed constraint. The assigned is at 124.1 and the unassigned at $70.3 million. It's important to note that as part of the $70.3 million, the overall organization's 50% reserve for the operating budget is reflected in that bucket. Now to move on to some trends. On the next 3 slides, I will talk about trends and activities that we are currently observing for the last 3 fiscal years. This graph reflects our declining fund balance as we continuously rely on to offset our revenue over our expenditures. As presented in the prior pie chart, the fund balance as of June 30th, 2023 is $257.7 million, which decreased by $12.2 million from the prior year balance of $287.9 million. On this slide, we reflect a 3-year comparison of our revenue and our expenditures. The table continues to reflect First 5 LA's planned pattern of spending more than what we are bringing in, reducing our fund balance on an annual basis. This slide also reflects the organization's effort to reduce our expenditures and align our costs to our fiscal reality of declining revenue. And for the last comparison, I like to show our program versus our administrative expenditures. Looking at the right-hand side of the graph for fiscal year 22-23, the administrative cost of $12.3 million of the total actual expenditures is below the spending cap of $14.3 million approved by the board. The total program expenditure of $79.6 million for fiscal year 22-23 includes provider grants and allocations, as well as operation expenditures in direct support of program efforts. This ends my presentation, and at this time, I would like to invite Kanali Sakusian, who is our CPA's firm from Eide Bailly's partner, to say a few words about this year's audit engagement. Kanali?
All right. Thank you, Raul. And good afternoon, everyone. And thank you for having me participate in this meeting. My name is Kanali Sukasam, and I am the partner with Eide Bailly. So we've completed our audit for the fiscal year ending June 30, 2023. And I just wanted to take some time to discuss what our responsibility under generally accepted auditing standards were, and also to discuss the results of our audit. So our scope of work was to provide an opinion on the Commission's annual comprehensive financial report for the fiscal year ending June 30, 2023, and also to test for compliance with the standards and procedures for audits of local entities administering the California Children and Families Act issued by the California State Controller's Office. We plan to issue an unmodified opinion or a clean opinion which on the Commission's financial statements, which is the highest level of assurance over the financial statements. As part of our financial statement audit, we also considered the Commission's internal controls and designed our procedures to gain reasonable but not absolute assurance. We also performed tests of compliance with laws, regulations, and contracts, those which could have a direct and material effect on the determination of the financial statement amounts. In addition, we also reviewed the required supplementary information to ensure that the amounts contained in those sections were consistent with the information that were presented in the basic financial statements. These significant accounting policies used by the Commission are described in Note 1 to the financial statements. There were no significant changes in accounting policies used. There were 4 accounting pronouncements that were effective this fiscal year. However, through the evaluation with First 5 management, we determined that these statements did not have a material impact on the Commission's financial statements. There were no uncorrected misstatements identified during the course of our audit. And as Raul noted, we did note 4 areas of improvement, which is identified in the management letter. Management is implementing changes to address these comments. Lastly, I'm happy to report that there were no difficulties with management and staff during the course of the audit. We certainly appreciate serving as the Commission's auditors and would like to thank Commission and staff for their for the collaborative effort as part of the audit process. And with that, that ends my presentation. We'll be happy to take any questions that anyone may have.
Great. Thank you so much, Raul and Kanali. Commissioners, any comments or questions for our finance team? Commissioner Byrd.
So I actually want to start just by taking a pause to recognize the award that for First 5 got for the previous fiscal year's audit. I think that as a commissioner who has some fiscal responsibility, liability, the commitment of First Five to go above and beyond in fiscal transparency means a lot. And I do really appreciate the work of your leadership and your team's leadership in helping to achieve that award.
Thank you, Commissioner Byrd. I wrote that down and underlined it. That's so impressive. 15 consecutive years. So First Five LA is doing a great job of being good fiscal stewards. So thank you for that. Any other commissioners with any comments or questions?
Second the comment. Thank you.
That was great. Thank you. Ms. Vo, are there any public comments?
Well, before we move on,
sorry.
let me just cover some next steps. And I also want to also compliment our partnership with iBailey. You know, iBailey was independently selected to be our so not only are they our auditors and they provide a significant partnership, but they also provide partnership across the association and the First Five network. A perfect example of this is some work that I led with the association and invited iBailey to present a thorough understanding of GASB 96. So it's just a perfect example of great partnership between First Five as an organization, an independent auditing organization such as iBailey across with the whole system that we call First Five as a network. So I just want to acknowledge and appreciate you, Kanali, for that support and just acknowledge the work that we're doing across, not only as an individual organization for LA, but for the actual First Five system as a whole. And I just think it's important for us to highlight that. And then as for next step, this report is due November 1st to the State Controller's Office and to the Los Angeles County Controller's Office. We are a component unit of the county, so our audit does roll up to theirs. We will be asking for the board to approve the audit on the 12th, and then we would submit the report to both the First Five California, and then we would use this information to update our long-term financial plan. And then as for me as the Director of Finance, for the ask for both the Executive Committee Members Chair and the Financial Committee Chair, we don't ask for action, but we do ask for endorsement so that we can bring it to the board on October 12th for approval.
Commissioner Byrd?
So there's two other comments I wanted to raise real quickly. One is the administrative costs reflected on slide 14. I think we've had prior conversations about revisiting the administrative costs and what are captured there and what might better be aligned with program expenditures. So I want to keep that on our radar because I do think it could give us a little bit more cushion for other administrative costs that start to expand, if we can better align some of those costs with program expenditures where they might better fit. So that's one. And then I wanted to touch base real quickly around the reserves. From a departmental perspective, 50% reserves seems a little bit high for an organization that's this stable. And I was wondering about whether we might want to consider reducing the reserves to 30 or 35%, which would then free up 15 to 20% of those dollars to reinvest in something that produces a higher yield for the organization.
So you are just music to my ears. Yes, we are, as part of the strategic plan, we did say that we will be looking at some of our operational policies and procedures and our approach. Both of the ones that you have touched are administrative overhead cost, or how we define our admin cost. That's an area that we have been highlighting that we definitely want to revisit. We do have a very I don't know if it's conservative or liberal, but the way that we define our administrative cost, we I mean, we count 100% of Carla's time, 100% of our Honorable John Wagner's time as admin cost. And they are leading significant program work, especially in the systems change and the partnership that John has created between us and the county. Those are all program related costs. 100% of his time is not admin. So we definitely have that on our radar to revisit in the calendar year of 2024. As for the reserve policy, definitely music to my ears, like I said. We do have a significant reserve of 50%. I think we definitely do need to revisit what that percentage looks like. When we initially did our assessment back in 2015, when we adopted the 2015-2020 strategic plan, we did look at our reserve, and we did take a conservative approach in that we wanted to make sure that we had 6 months of resources available to function if the worst case scenario did happen. But with the current market and the rate of return that we can possibly make, any resources that we can make available to us to lock up and to make a better return on investment goes back to the presentation that we did to the commission this month about how we maximize our assets. And that's an area that we definitely want to really focus on and see where we can maximize our assets, such as our significant fund balance. So thank you for those questions and comments.
Can I ask a question? Simple question. What is our rate of income on the reserve account, the interest?
So we have a significant amount of roughly $134 million that's locked into a rate that's right south of 4%. And we locked that in when the rate at the county was below or right above 1%. So we almost doubled our rate. But now with the market, there's opportunities to even get a better rate of return on whatever cash that we can make available. So yeah, great opportunities.
Any other questions or comments from the commissioners? Great questions. And again, Raul and Kanali, great job. Ms. Vo, any public comments?
Confirming there are no public comments. And before we move on to the next item, just a reminder to commissioners and presenters to speak clearly into the mic so that all of our remote attendees can hear clearly. As my mic was going out.
So I know you asked for an endorsement. Do you need that a vocal endorsement? Because I would provide that endorsement to move forward.
Yeah.
Okay.
That'd be nice.
All right. Thank you, Commissioner Byrd. Thank you, Raul. Our next item on the agenda is First Five LA's annual First Five California be presented by Hari.
Hello, good afternoon, everyone. Good afternoon, commissioners. My name is Hari Kim Han from the Office of Data for Action. I'm not feeling 100% or too well today, so I am joining virtually and will be presenting on the second of the 3 annual proceedings today, specifically on First Five LA's annual report to the state. So in adherence to Prop 10 funding requirements, First Five LA submits the report to First Five California on an annual basis. Today, I'll be summarizing the fiscal year 22-23 preliminary annual report findings in preparation for delivering the full annual report to the board at the October 12th Board of Commissioners meeting. Also supporting our state annual reporting work is Limor Zimskin from DataLink Partners. She's not here, and it's just me presenting today. In terms of the agenda, I will begin by providing a background on the state annual report, then transition to reviewing the preliminary results for First Five LA's annual report and on populations reached through our investments. I will then provide a summary of the key takeaways and conclude with overview of next steps. So let's begin with some background information on the state annual report. As you know, First Fives are funded through Prop 10, and one of the funding requirements of this legislation is a state annual report. In order to generate this report, First Five California collects data from each First Five County Commission, and there are 3 sections that each county needs to report on. One is a summary of revenue and expenditures. Second is a demographic worksheet, which includes data on populations reached and their demographics. And finally, a summary of evaluations conducted and key county highlights and accomplishments. Once the data from all 58 counties is received, First Five California synthesizes this information in a single report. You may remember back in June, commissioners approved the receipt and filing of First Five California fiscal year 2021-2022 annual report, which is available through First Five California's website. So you may be wondering where First Five LA gets our data that we need to submit to First Five California. So there are 3 sources of data in this organization-wide process that are combined to generate First Five LA's report to the state. First, the grantee survey gathered information on populations and demographics of those reached and key accomplishments from the past fiscal year. We also report on data gathered through our annual financial audit, which you heard about from my colleague on the finance team, Raul, in the previous agenda item. Finally, we work with other First Five LA staff to summarize evaluations conducted within the fiscal year. Today, I'll be focusing on preliminary findings of First Five LA's annual report data to the state, which includes information on the number of grants and the populations reached through our investments. The full report will be provided as part of the board materials that will be posted for the October board meeting. First Five California also requires that investments be categorized using First Five California's 4 result areas. The child health investments are those that provide services and supports to improve child health. So these include investments such as Welcome Baby and home visiting programs. Child development investments are those that provide funding for and improve early learning programs. So our ECE Workforce Registry and our Quality Start Los Angeles investments fall in this category. The family functioning investments provide either short-term or intensive family supports. Our Little by Little early literacy program is an example that falls under this category. And finally, the systems of care investments are those that focus on advancing systems change, such as public advocacy or policy, as well as systems building efforts. Our Best Start Regional Network grantees, policy advocacy funds, and Help Me Grow LA are examples in this category. It is important to note that First Five California result areas is not how First Five LA frames our work and provide an additional perspective than our typical approach to telling First Five LA's story. So this brings us to our preliminary fiscal year 2022-2023 results. I'll focus on how grants were distributed, the number of populations reached, and the age, race, ethnicity, and primary household language of children reached by First Five LA investments. So starting with our grants, in fiscal year 22-23, First Five LA had 86 programmatic contracts and grants. As a comparison, this is 16 less than the previous fiscal year as there were contracts that termed out. The bars on the chart are showing us the proportion of grants that fell within each First Five California result area. As we continue to fund, greater proportion of grants focused on advancing systems change, with 47 out of 86 or 55% categorized under here, which is expected given First Five LA's strategic focus as a systems change agent. Out of the result areas that focus on providing direct services, the majority of grants First Five LA funded focused on improving child health. We will now look at the populations reached through our direct service grants. Even as the total number of First Five LA grants decreased from the previous fiscal year, First Five LA reached 5% more children and primary caregivers. This increase in numbers reached came mostly from our Little by Little grant, and there was also a small increase in the numbers reached by our Welcome Baby, Select Home Visiting, and First Connections grant. This year was the first time collecting data on pregnant individuals to give us more insight on the prenatal populations reached. In fiscal year 22-23, First 5 LA grantees reached 1,590 pregnant individuals, almost all of whom were reached by the Welcome Baby grantees. In fiscal year 22-23, First 5 LA also reached over 20,000 unique families through our home visiting and Welcome Baby investments, and over 20,000 providers, mostly through our ECE workforce registry investment. On the next 3 slides, we'll be focusing on child demographics. Looking at the age of children, the majority of children reached through First 5 LA investments continue to be less than 3 years old. Welcome Baby and First Connection grants reached almost exclusively children less than 3 years old. Consistent with previous years, it appears we are prioritizing supports during the critical development period that occurs birth through age 3. This slide shows the breakdown of race and ethnicity of children reached by First 5 LA investments. In fiscal year 22-23, more than 9 out of 10 children reached through First 5 LA investments are children of color, with the majority being of Hispanic and Latino background. In addition, we also compared the distribution of race and ethnicity of children reached by First 5 LA investments, which is represented by the blue bars, to LA County children ages 0 through 5 reached by Medi-Cal, which is represented by the green bars, and the race and ethnicity of children ages 0 through 5 in LA County overall, which is represented by the pink bars. Many of First 5 LA's investments focus on serving families and communities with high needs, so we knew that the distribution would not match that of the counties. Therefore, we also compared it to Medi-Cal, which also serves segment of the population with higher needs. First 5 LA reached a higher proportion of Latino and Hispanic children compared to both Medi-Cal and LA County children. However, the rest of the race and ethnicity groups were underrepresented, including Black, White, Asian and Pacific Islander, and multiracial children. While not the same, the race and ethnicity of children reached by First 5 LA investments are more in line with the Medi-Cal population for children ages 0 through 5 years than LA County overall. This slide shows the breakdown of primary language spoken in homes of children reached through First 5 LA investments. English was identified as the primary language spoken in homes for about 2/3 of children reached by First 5 LA investments. Almost 30% speak a primary language in their homes that is not English. So although we are reaching Latino and Hispanic children, grantees are reporting that the majority of the children come from households where English is a primary language. One consideration is that grantees only report on the primary language spoken at home. So there could be families who identified English as their primary language, but could be in multilingual homes, but this information is not gathered. Another consideration is the comfort level of caregivers responding to the question about primary language. They might feel stigmatized or discomfort in identifying another language than English as their primary language. With that review of the results, I will summarize the key takeaways and then discuss next steps. In reviewing the preliminary findings, there are 4 key takeaways I'd like to highlight. First, more than half of First 5 investments were focused on advancing systems change. Related to this point, I'd like to note that First 5 California currently does not collect detailed data on the systems change work being done by First 5 county commissions. However, we'll be highlighting First 5 LA's work in advancing systems change through our county highlights, which we will share during next month's board meeting. Second, the majority of children reached through First 5 LA investments are younger than 3 years old. Third, through First 5 LA investments reached a majority of children of color, there is underrepresentation of children across all race and ethnicity with the exception of Latino and Hispanic children. Finally, English is reported as the primary language spoken in most homes of children reached by First 5 LA investment. So before we transition to our discussion, I'd like to give an overview of the next steps for the state annual report. First, we will finalize the report content by incorporating the revenue expenditures data and the county highlights. Next, we will present the rest of the report sections at the October 12th Board of Commissioners meeting and request approval to submit the full report to First 5 California. Finally, upon receipt of the approval from commissioners, we will submit the report through First 5 California's data system by the October 31st submission deadline. So with that, I would like to open it up for questions and discussions, and thank you so much.
Thank you, Heidi, for that presentation. Commissioners, any comments or questions?
I have one question. Hard to see you up there, but I can wave every once in a while. I'm really interested when we look at the breakdown that's by race or by language or whatever, is looking at the economics of those various groups. Like, where are they on the poverty scale? And so we get an idea of the role that finance and money play in their needs. I mean, I can see that a little bit through Medi-Cal, but I mean, that's a lot more interesting, I think, in terms of how we bring global change for all races in this country, is to look at the economics. And regardless of race, obviously that plays a role, but I'm really interested if we could add that to our assessing the various individuals, families that we serve.
Yeah, so data on income is not data that is required by First 5 California. So we currently do not ask grantees to break down information for populations served by their income levels or poverty levels. And so that's why we try to compare it with the Medi-Cal populations when we looked at the race and ethnicity. But that said, we are looking to see what our First 5 LA's data needs. And that could be something that we might want to explore in the future. And I don't know if Kim Hall is there too, if you want to speak more to it. But just to give a little bit of context of what First 5 California requires, they don't require us to report out on any sort of like income or poverty levels of people reached.
Thank you. Thank you, Commissioner Hager, for the question. Executive Director.
Thank you so much, Commissioner, and completely agree. This is trying. This is one of the questions that we're examining with the strategic plan. So you will see indicators that look at poverty in the overall strategic plan as part of our analysis.
Thank you. Thank you, Commissioner Byrd.
So I also wanted to focus on slide 11 for a second around the population served. And I'm wondering if part of the underrepresentation that's being identified is related to the staffing makeup of the agencies delivering services. If we're not, for both language and the race and culture piece, because I think that as the organization shifts to emphasize its equity, diversity, and inclusion work, I would like to see a better representation that reflects the county's demographics, but also the needs in the communities that may not be currently getting reached.
Commissioner Allen. Thank you, Commissioner Byrd.
I think an interesting question to ask is also what % of the population is native born? Because I mean, my experience, this is totally anecdotal, but my experience is that while particularly in recent years, there's a lot of fear on the part of immigrant families, there's also less historic distrust of services when somebody offers you supports than I think there is in some populations that have long histories of skepticism based on valid experience. And so I think it's worth looking at, to what extent are these people who are sort of fresh to the idea of having somebody come and offer something. And that, I mean, I think all the things that Robert said about, that Commissioner Byrd said about the language, ethnicity, race, et cetera, of providers is relevant as well. But I do think there are both communities in which receiving services is stigmatized and communities in which there's a lot of skepticism about anything in sort of organizational and institutional that comes to their door offering, it's we're the government, or we're, some organization and we're here to help you. So I think, I think native born is one way of getting that. In terms of income, I mean, Medi-Cal is not, a very finely attuned measure, but it is, you have to be pretty poor to be eligible for Medi-Cal. So I wouldn't dismiss that as a marker for what level of population is of, for a given race ethnicity group is, in need of services that may be related to poverty. I mean, the other thing one could use is address. Again, not a perfect marker, but it does tell you something about how many people are in communities where there are high levels of either low income or segregation, both of which are markers of community need.
Commissioner McBride.
Thank you for this presentation. First, I want to echo Dr. Allen's statement about the income not necessarily being one of the more important markers, especially when you consider the disparity rates for Black infant and maternal mortality. When you control for income, marital status, educational status, the disparities are still the same. And so we don't want to corner ourselves into looking at income and forgetting that barring all of that, we still have families who are struggling to get the services and the care that they need to get the outcomes that we want. In addition to that, I have a question about just a definition for systems change. How are we defining system change, especially as it relates to looking at slides 6 and 8, because the percentages are low for child development and family functioning. So in that context, how?
Yeah, thank you for that question. And thank you, commissioners, for the for your comments as well. So how First Five California defines systems change is, I want to pull up the exact definition, but they consider public policy systems change or anything that has to do with systems building efforts, and also efforts to respond to emergency crisis such as COVID-19. The other 3 result areas, how they define it is work that provides direct services. So anything from home visiting or providing direct services to children, families, and or providers. So those that provide services to children and families. So we consider that, and First Five California categories is that under the child health, child development, and family functioning. And so they have a specific definition for each category that we need to categorize each contract under.
Thank you for that.
Thank you for the question, Commissioner McBride. Commissioner Allen.
Just to follow up on that, given how much of the budget goes to systems change, I mean, I would think we would want to encourage First Five California to consider that a marker of success and not just individuals, children served. And I think it raises very interesting questions about how you might quantify the impact of particular changes, and ask, are we focusing on the right areas of system change in terms of both the number of children and families affected and the impact, which I think would be very interesting. I think it would be a very useful exercise to have some sense about, just as you might measure quality in a program in terms of the impact it had on children and families, how big a deal was it, that some system was affected. And I think particularly realistically, as the budget contracts, that there's more and more of a focus appropriate for First Five in that area. Because delivering direct services is really expensive for, I think it's very important and I think it needs to happen, but it may not be the optimal role. And then I think being able to say, this really mattered. This wasn't some throwaway.
Thank you.
Can I read?
Yes, Carla?
In regards to the systems change definition, completely agree with what's being shared here. There's the track of our strategic plan, our new strategic plan, and those questions of clearly defining and focusing and narrowing are part of what will come to the board on October 12th. And we are defining it differently than this report requires us to look at. We'll take into advisement connecting with First Five California and lifting up that commissioners here are sharing the importance of looking at that definition, and we'll bring our own definition, but that's the input we will be seeking on October 12th. How are we going to be more narrow in focusing that particular definition? Because right now it's been broad. To Hari's point, it's been looking at policies, direct services, mental models that exist in organizations. So there's some direction on that.
Ask a question.
Yes.
What is California, First Light California's budget? What is their budget? Do you know?
Not off the top of my head, Commissioner. We could circle back with you on what that budget is because it is public information. Yeah.
I don't know the exact budget off the top of my head, but just a reminder about how Prop 10 funds flow, where First Five California maintains 20% of the statewide revenues from the tobacco tax and then distributes the 80% to the county commissions like us. And we receive about 25% of that 80%. So we can get the exact number, but it is 20% of the statewide collection of Prop 10.
Slightly less than LA, I would.
Yeah. It would be less than LA.
Interesting article in LA Times. Sole issue. All of you probably saw it. We should probably share that, questioning the budget and the future of both the state and the county programs, some of which I guess are in serious trouble to even survive.
Commissioner Ramirez.
Thank you. And thank you for this presentation. I had a question about the key takeaways. Just my question is, key takeaway number 2, that the majority of children reached are less than 3 years old. That's strategically, or is there some other reason why it's 0 to 3 that's the focus?
Hari, I'm happy to jump in unless you have a response.
Well, I could provide context of what programs reach the 0 to 3 population. And those include Welcome Baby investments, home visiting investments, as also Little by Little investments, which is headed by, the Little by Little is headed by WIC. And so that's the context. And I just wanted to give a little bit of background information about who is serving these populations younger than 3 years old.
And to the strategic question, as we look at our strategic plan, it is looking at a P-5 agenda. So we will be seeing some shifts on this. And right now, as Hari answered, it's programmatic focus. We report on services that are offered because that's what First Five California is asking us to collect. But the strategic decision moving forward is looking more at a P-5.
Okay, great discussion. It's great to hear ideas so that we can stay focused on our population. Carla, appreciate the response as well in the collaboration. Thank you very much. Any other questions from commissioners? Ms. Vo, are there any public comments?
Confirming there are no public comments on this item.
Thank you. This concludes the items that are within the purview of the executive committee. So I will hand this meeting back over to our honorable Commissioner Hager to lead.
I'm working on the honorable part. We'd like to move on to the next item, which is an annual review of the First Five's current strategic plan. This is a public hearing item, so we will now open up the public hearing. Antoinette is going to lead this discussion. How are you? I'm fine.
Good afternoon, commissioners. Can you hear me okay? So again, good afternoon, commissioners. Good afternoon to my colleagues who are present, public who may be present and attending virtually as well. This is actually the last of the 3 presentations taking a retrospective look at what First 5LA accomplished during the last fiscal year. As my colleagues Raul and Hari explained, there are certain requirements First 5LA must adhere to as a condition of Proposition 10. So commissioners have heard about the annual audit as well as the annual report. And I need to remember to advance slides, right? And so there are some other requirements from Proposition 10, an annual public hearing on our strategic plan, as well as any public hearing on changes to First 5LA's strategic plan. Today's presentation is on the current strategic plan. That is the 2020-2028 strategic plan that was approved by the board in November of 2019. I will provide some highlights from the last fiscal year, which is actually year 3 of the 2020-2028 strategic plan. And my colleagues here from health systems and family supports and early care and education and the communities teams are here to answer any specific questions that commissioners may have about anything that I'll be covering in the presentation. And then we'll receive public comments as part of the public hearing on the annual strategic plan. Okay. So our work over the last fiscal year advanced 4 strategic priorities. We focused on improving systems to become family-centered, child-focused, and to promote equitable outcomes. We sought to build connections, support community-driven systems change, and maximize resources within the 5 Best Start regions. We looked for ways to elevate parent and provider voice using qualitative data to deepen our understanding of the experiences of children prenatal to 5 and their families. And finally, we worked to strengthen our organizational effectiveness. And as the work was unfolding, First 5LA also started its 3-year review and refinement cycle of the strategic plan. Now, because the strategic plan is 8 years, spanning from 2020 to 2028, the review and refinement cycles were built into the plan to adapt every 3 years based on shifts in the external environment, our fiscal reality, and evolving role. Now, there is a tremendous amount of good work that is happening in each of these 4 areas that I just outlined. And throughout last fiscal year, staff shared progress and engaged commissioners as thought partners through the various board presentations and discussions that occurred the last fiscal year. So today we're going to focus on a small sample of the work that First 5LA is currently doing or did last year to illustrate that we have engaged in a variety of partnerships, supported communities in advancing their priorities for young children and families, strengthened the capacity of organizations, leveraged non-First 5LA funding to support the work, and reconsidered our strategic plan to clarify our strategic direction.
Year 3 implementation illustrated our deepening commitment to partnership to increase the access and availability of public resources and services. It isn't just about First 5 LA being a partner, but also cultivating partnerships at the local level. So I will highlight a few areas of work to illustrate the diversity of partnerships. Through Quality Start LA, First 5 LA worked with partners to draw down state funding to implement, expand, and stabilize quality improvement services in diverse early care and education settings throughout Los Angeles County. The Antelope Valley Resource Infusion is a collaboration between First 5 LA, the LA County Department of Children and Family Services, Department of Mental Health, community-based organizations, other funders, and residents to improve access to and coordination of services in neighborhoods where families are experiencing the greatest inequities. Through the Families First Prevention Services Act Community Pathway, First 5 LA is collaborating with multiple county agencies to support pilot projects focused on building, improving, and integrating referral pathways into prevention services. This work is done in partnership with county departments of Children and Family Services, Public Health, Mental Health, Probation, also Office of Child Protection, Commission for Children and Families, the Children's Data Network, and providers. And all of us are working together to coordinate services for families to mitigate the risk of entering the child welfare system. The Link Advocates, Government, Families, and Parks Initiative, because we couldn't think of another way of naming this, but at least everyone knows who's being linked here. But it's one example of First 5 LA's work to cultivate partnerships at a community level. So in partnership with other funders, First 5 LA created the LINK model of collaboration between under-resourced municipalities, community-based agencies, parents, residents, and technical assistance providers. And through joint community-driven planning processes, stakeholders work together to identify park needs and opportunities, develop priority park projects that align with community interests and needs, and to build the capacity of municipalities to draw down dollars from public funding streams. Now, those First 5 LA's investment in this was approximately $750,000 over a 3-year period. Because of this project, $31 million was actually acquired by municipalities in the cities of Maywood, Cudahy, and El Monte, so that there's improved park space. So our small investment actually brought in quite a bit of money, not just our financial investment, but our work to actually cultivate partnerships at the local level. First 5 LA is also a member of the National Home Visiting Coalition Steering Committee and was a critical voice in advocating for the reauthorization of the federal maternal, infant, and early childhood home visiting, the MCV funding. And First 5 LA is a key driver of the Home Visiting Leadership Steering Council. Home Visiting Leadership Council Steering Committee that supports countywide collaboration efforts to identify new funding streams for home visiting services, improve data sharing, and support the quality of home visiting services throughout the county. So those are the kinds of things that First 5 LA has done last fiscal year in the area of partnerships. For several years, First 5 LA has invested in community engagement, particularly through Best Start. So last fiscal year demonstrated how the work has evolved to create space for community wisdom agency to improve conditions for young children and their families from their earliest moments. Through the Village Fund and community action teams, First 5 LA supported Black-led organizations to implement innovative strategies for improving birth outcomes. Through Help Me Grow Community and Family Advisory Council, First 5 LA is supporting an advisory group comprised of 12 parent champions with a focus on ensuring early childhood services and resources meet the needs of families with children with or at risk of behavioral and/or developmental delays and disabilities. First 5 LA's support of participatory budgeting in Best Start regions is an example of community-driven grant making where communities determine the best use of First 5 LA resources to support their priorities for children prenatal to 5 and their families. And one example of this is over $550 Thank you, Becca. So one example of the community-based participatory budgeting is over 550 residents voted on community priorities through South LA Decides Initiative and Best Start Region 2, which comprises of Compton, Watts Willowbrook, West Athens, and the Broadway Manchester area. And one of the projects being implemented as a result of the vote is a guaranteed basic income pilot, providing direct cash payments to 100 mothers of children prenatal to 5 living in Region 2. And First 5LA continued its investment in strengthening networks in Best Start regions. Through network building, First 5LA and community partners are working to strengthen the web of relationships between parents, residents, organizations, public agencies, and other key stakeholders so that resources can be mobilized, that innovation can be sparked, and that there is collective action to improve conditions for children prenatal to 5 and their families. We also learned last year that strengthening the nonprofit infrastructure within communities is also critical to achieve meaningful results for children and families. First 5LA invested in capacity building to help stabilize, scale, and integrate, to help organizations to stabilize, scale, and integrate their efforts to better serve children and families. So some examples of this are First 5LA and the County Department of Public Health partnered with LA Care Health Plan to host a children's health conference. The conference, which is part of the Help Me Grow initiative, trained providers on how to integrate early identification and intervention protocols into practice workflows, and also increase awareness and education of the importance of developmental screening, supporting providers in having developmental conversations with families and caregivers, and ensuring that providers have the latest information on working with regional centers responsible for providing developmental services. First 5LA supports an early care and education provider advisory group to ensure the voice and perspectives of home-based ECE providers throughout the county inform our ECE systems work. The provider advisory group met with representatives from the Child Care Alliance of Los Angeles and the Child Care Resource Center to discuss provider experiences with their local resource and referral agencies to improve those practices. First 5LA, in partnership with the Children's Hospital Los Angeles, released the Early Screening Better Outcomes Developmental Screening, Referral, and Outreach Toolkit for Family Resource Centers. This is a practical guide to help family resource centers implement or refine high-quality approach to embedding developmental screening, outreach, and linkages to services. First 5LA also culminated a 2-year initiative that provided capacity building services to about 194 nonprofit organizations within Best Start regions. Those capacity building services included technical assistance, training, and coaching in the areas such as developing strategic partnerships, policy and advocacy tools, leveraging data, how to do systems change, administrative infrastructure, fund development, and organizational wellness. And one of the lessons from this work is that nonprofits, while they are resilient, need continued capacity building and connection. Across the nonprofit sector, many organizations serving communities continue to struggle in isolation due to the pandemic and the resulting economic fallout, as well as ongoing injustice. And so they're grappling with a lot of the kinds of external issues that we've highlighted through our landscape analysis most recently. And they're also grappling with organizational challenges related to funding and staffing and increased community need. And as Raul noted during his presentation on the audit, First 5LA has been doing a good job of attracting alternative revenue. And so Raul talked about that in the audit today. There was also a presentation earlier this month on the sustainability strategy, which includes generating alternative revenue. And so First 5LA, through its partnerships, was actually able to attract alternative revenue through sources such as those listed here. Finally, last fiscal year, we started to adjust First 5LA strategic direction. When the plan was approved in 2019, board members and staff knew that the work that we do is in a very dynamic context and that community conditions can change very rapidly. We knew that in 2019 and then 2020 hit with the pandemic. But with that understanding, we had the foresight to build in 3-year refinement cycles into the strategic plan so that we could be flexible and responsive to shifts in the external environment and apply learning from implementation for continuous improvement. So our first 3-year refinement cycle started last fiscal year. We were hearing from our staff and stakeholders that what First 5LA was trying to achieve, how and why was not clear. So the first review and refinement cycle was an opportunity to clarify and focus our work for greater impact. We completed initial refinements, which were approved by the board in November of 2022. With the change in executive leadership, First 5LA conducted an even deeper dive into the impact of the pandemic on children and families and how we might maximize our resources in spite of declining revenue to achieve meaningful results for children and families. So we conducted a landscape analysis of the internal and external context in which First 5LA does its work, which also included opportunities which the board provided some insight on that First 5LA can leverage to expand our reach and achieve long-lasting results. And now a new proposed strategic plan is being developed using a results-based accountability framework with clear goals, measurable objectives, and strategies. So we seek to actually answer the feedback that we got from our stakeholders and our staff that our strategic plan was not clear. So with our new proposed strategic plan, which we have been having conversations with the board with over the last several months, we seek to clarify what we're actually trying to achieve, how and why. So in terms of next steps, as I shared a lot of information here to the point where my microphone kept going in and out. But, you know, our colleagues will share more highlights and evaluation findings from our work from year 3. They will share that at the October board meeting. And at the October board meeting, we will also have another public hearing, but it will be on the new proposed strategic plan. So as I started the presentation, there is a requirement that we do an annual public hearing on our strategic plan and a public hearing whenever there are changes to our strategic plan. So that public hearing will be happening in October. And with that, that concludes my presentation. As I said, my colleagues are here to answer that you have about any of this work.
Thank you very much. I really appreciate that report. I sit here as a provider of care to those who have sunk way below certain lines of access to care. You know, and I really want us to focus on making sure that everyone has access to all these services and good services. And that's one of the things that I'm working on outside of my medical career is how do we build a clearinghouse of information so that families can get referred and get access to care. Because I found myself in my program during the pandemic responsible for providing food, housing, utilities, soap, clothing, back to school supplies to most of the patients that I see. It was a tremendously frustrating time for very poor people. And I wanted them to have so much of what we give, but getting access to it wasn't always easy for them. So in all of this, I am concerned about that population. And across the county, it changes in terms of who they are and where they come from, et cetera. And High Desert is very different than East LA and other parts of the county. So I'm really, and you've heard me say this before, that I'd love us to be more making sure that there's a clearinghouse of access and that poor families don't live in isolation, and not knowing that they could have so much of what, what we want to deliver. And that's I mean, I learned so much from my patients in terms of what they need, and we underestimate. I mean, things like laundry soap. I mean, there's simple things like that people need and that they don't have access to. So I'm just a proponent of that. That's why I talk so much about the economics, because my population doesn't know how to have access. And I'd love for them to have home visitation. I'd love for them to have a better early childhood education, and they don't know how to get there. So that's where I am. But thank you very much. It's enlightening and wonderful to be part of this commission because of what you guys do. And you have my high regard. Anything else?
I just have one. I totally agree with Astrid. It's really, really hard to figure out how to provide the necessities of families, but to enable them to know how to access. So when you say public hearings, I light up because I think, okay, now we're going to be out there and we're going to get all this feedback directly, and we'll know exactly how the public feels about what we're doing. It's a challenge. So I'm just saying, maybe we can really focus hard on how those public hearings are presented, what the language is, where they are, who's invited. Because if we just stand up there and say, what do you think of our strategic plan and the logistics of it? Well, it's very different from what do you specifically need? How can we help you? It's a challenge. So when we get to that point, I'd like us to kind of be creative about it. So thanks. Great presentation, Antoinette. Thank you.
Yes, Summer.
Thank you for this presentation. I just have a question about slide 7 where it says attracting alternative revenue. And please forgive me if I should know this, but what percentage of any of our revenue comes from philanthropic partners and endowments? And is there an effort to increase that?
That is a good question. I'm happy to address some of this. So Commissioner, one, we've made a strategic decision to not go after philanthropic dollars so that we're not in competition with community-based organizations that are often looking to get those dollars. And in regards to diversifying our funds, there is a sustainability plan that the team is looking at that will look at one part, our internal assets to diversify funding. So look at building space and use. And then 2, sort of public policy agenda that looks at additional dollars that might be coming down to LA County. And we partnered with departments here to look at that diversity, but we're happy to go over that. But philanthropic dollars is not something that we want to get in the business of.
Thank you, Carla. And one thing that I would just add is, so I'll use Link as an example. We're not going after philanthropic dollars, but we do invite our philanthropic partners to the table to actually, so that we're able to maximize additional resources. So it's not coming to us, it's really going to shared priorities.
Okay, thank you.
Great. You just answered one of the questions I was going to raise, is that if we're not directly going after philanthropic funding, how do we better partner with our CBOs within the communities at greatest need or high need to maximize those opportunities? Because I do think there are times when philanthropy does want to work with First Five, given the mission. More so than a CBO that may not be as well known because of the stature and reputation of the organization. The second question I had alongside Commissioner McBride is, what grant funding is the organization pursuing, and how do we maximize some of the grant opportunities that may be coming down from the state in partnership with other county departments or CBOs or independently.
You want to?
So the EC team does bring in some state dollars, mainly through First Five California with our impact funding, and we actually partner with LACO on that. So LACO pulls down 2 state funding streams and we pull down 1. We're able to sort of blend and braid that funding to sort of fully fund Quality Start LA. So we're always looking for opportunities like that. So that's an example of something that's existing, but there are other opportunities out there we should be exploring.
So just to add to that, and I really appreciate that information. I'm not sure I knew about that before. And I do think that there's opportunities for partnerships across multiple county departments. Commissioner Allen, because there's opportunities around prevention and early intervention being enacted at the state level. And I think that there will be grants coming and continuing to come that we would like to partner from the DMH side with the organization on.
I mean, I would just add a lot of those listed on the attracting alternative revenue are state dollars, right? So for AIM, I can speak to the MOU we have with VPH. Those are state funds through Perinatal Equity Initiative. So I think a lot of the funding we're leveraging right now, it's a state Medi-Cal, obviously that's state funds. So yeah, we're definitely looking at it and would love to continue to think about where things are coming and shifting and changing to be ready and access that.
Deborah, did you have a comment?
It was the same question. It was the same point about leveraging philanthropic dollars rather than pursuing them.
Yeah, I agree with that. I think that's an excellent idea. Are there any other comments from the commissioners or anyone else in the room?
Well, I'd just like to add that in the communities team, we've actually really started to lean into our role as connector. And a lot of our community-based organizations have been asking, how can First 5 LA connect us to other funders? So you have that visibility, you have those relationships. We've actually designed our agenda to really be able to create spaces where we can bring groups together. And in Long Beach, for instance, they've reignited the Funders Collaborative that came from the California Endowments Building Healthy Communities effort. And to really look at how do we partner, how do we support local community-based organizations, but also the work that is coming from the Best Start regions. So that's something we hope to replicate in others as well.
You know, I think that's really a great idea to be a connector and a facilitator and an enabler to get various community organizations to be qualified to go after grant funding. And also one of the things that, and on a national level, working with some of the child abuse organizations, looking at leaders in the field and their ability to help organizations meet the qualifications. In other words, have the data, have the expertise, have the ability to review their proposals and enable them to be more effective in bringing in dollars. That's one of the recommendations that we're making and looking at, and how can we make them be more viable in that regard rather than competitive. I think that's an issue. Are there any other comments, or are we going to go to public comments at this time?
We do have one public comment, and it's a virtual public comment from Fiona Stewart. Ms. Stewart, you do have 2 minutes, beginning now. Ms. Fiona Stewart?
Good afternoon. Can you hear me?
Yes, we can hear you now.
Great, thank you. Good afternoon. My name is Fiona Stewart, and I am the program director for the Child Care Alliance of Los Angeles. We are a longtime partner with First 5 LA, and we thank you for all your support and collaboration through the years. What I wanted to elevate today was the support for the early care and education workforce as you continue to think about your strategic work going forward. So those early educators who provide the nurturing relationships and environments and the high quality childcare necessary to build that foundation for children's lifelong success. Given your focus on systems change work that we've heard about today and what seems to be less investment in child development, I'd like to raise the concern that this workforce is critical to the systems supporting children's outcomes, as well as families' economic stability. In short, childcare keeps LA County families working. Perhaps this subcategory could be included in how you present your systems change investments. And as you know, this is a workforce in crisis. As Dr. Austin and others at the Center for the Study of Childcare Employment continuously champion, this is a workforce that is frequently under great stress due to low compensation, little access to benefits, and challenging work environments. And this stress, on top of the historic and systemic racism and sexism built into this field, make achieving and sustaining the high-quality environments and nurturing relationships known to impact children's outcomes. And as you heard, when we recently presented the home-based childcare landscape analysis done in partnership with First 5LA, across the various home-based providers in our study, whom parents choose and need to care for their children, more than 60% of them do not have any access to benefits, less than 10% of any retirement account or paid sick time. So we'd appreciate all you have done to lift up this workforce, and we urge you to keep them at the forefront of your strategic planning work. Thank you for your time.
Thank you. Are there any other public comments?
There are no other public comments.
In that case, we'll move on to the next item, which I believe is a break.
That is correct.
We'll take a 10-minute break at this time, which means we should be back here at thank you very much.
I know, see.
That's really interesting.
First I met with, and then I met with you today. Getting around.
Okay.
That was a great discussion. Covered so many things.
So, places. At the time I was appointed to that one. Okay. Fantastic. April supervisor. I've done a lot in like parent education. Like an independent contract. On staff, but. About you?
I'm the Early Childhood Strategic Initiatives Program Manager for the City of Long Beach.
Okay, say that again.
Early Childhood Strategic Initiatives Program Manager.
Days where you're like perfectly suited for this.
Yeah, I also serve as chair of the LA Policy Roundtable.
Okay.
And so the non-voting position to really help us link our systems, which is our theme for the year. Between, the work that's happening.
The fast food where now $20 an hour is still class, but it's a lot better. Yes. Yes.
We'll pass that on to the consumers. So we'll make that $20 increase for that $20 minimum actually feel like less because of inflation.
Yes. It's barely keeping up. I mean, all the that real income people has decreased in buying power over the last 30 years. So absolutely. And of course it makes a difference. I mean, if you're spending half your day going pantry trying to eat kids, your health is affected by it.
All right, we're gonna get started again. According to my phone. It's 3:11. Our next item is item 8, which is our 2023 advocacy review and 2024 policy agenda. Ophelia is going to lead that discussion. Thank you very much for being here. You guys are amazing. Anxious to hear what you have to say.
Ophelia, if I may just interrupt for a moment, I do want to indicate for public record that Yvette Martinez did step off of the meeting, but we still have quorum, so we can proceed with all of our commission items for today's meeting.
Thank God for you, Linda. I mean, I'd be lost. All right, thank you, Ophelia.
Thank you. Good afternoon, commissioners. Anais and I have the pleasure of going through a lot of the work that our OCAP team or our Office of Government Affairs and Public Policy team did. And I will say that they're all sitting in the back providing support. But to help guide the conversation for today, we wanted to provide you a quick snapshot of the topics that will be reviewed. First, we will provide some context setting and a recap of the policy and advocacy activities of this past year. Some of them are still ongoing because the legislative season isn't quite over yet, nor is the federal season. This will include a review of First 5 LA's state budget, legislative and administrative priorities, as well as the activities at the federal level. Anais will dive into the 2024 policy agenda update, where we continue to outline our approach, given the status of the strategic plan to ensure that there's alignment. And finally, we will provide a preview of the 2024 advocacy and board engagement through the first 2 quarters of the year, and then open up the floor for any questions or comments that you might have. Before we dive into our discussion of the 2023 policy and advocacy activities, I do want to provide you with a quick refresher on the political and budget landscape we had this year. At the state level, this year's budget was projected to be at a deficit of nearly $32 billion, a complete contrast to prior years where we had seen an unprecedented surplus. This is mostly due to lower tax collections and because of the tax extension. So we don't know and we won't know the full picture of the state's financial standing until later this month. Despite the forecast, we did see childcare remain a top priority for the legislature, becoming a tough negotiation point during the budget negotiations with the administration and the members. Adding to the complexity of things, Sacramento did welcome its largest freshman class of legislators in over a decade and voted on a new assembly speaker, ushering a new era for California politics. For our government affairs team, this meant having to introduce our work and educate new policymakers on the importance of prenatal to 5. Finally, on February 28, Governor Newsom ended California's COVID-19 state of emergency, signaling a shift in how state lawmakers could be approaching investments during the 2023 legislative and budget cycle, where previously much of the state's resources and focus were on combating the impact of the pandemic. At the federal level, the national public health emergency also ended, and because of the current landscape, at the moment, we have more reactive than proactive opportunities. We also wanted to provide the commissioners with a window into some of the departments and agencies that our work aims to impact. At the state level, examples are the Departments of Healthcare and Services, Social Services, and Education. Federally, we have the Centers for Medicare and Medicaid Services, Health Resources and Services Administration, and the Department of Agriculture. Over the course of 5 years, OCAP has made a concentrated effort to increase our administrative advocacy, knowing that even if a state proposal successfully passes through the legislative process and ultimately is signed by the governor, it could still be voted, and there's a lot of work to be done at the implementation level. Moving forward into the presentation, you'll see us call out the different departments and agencies connected to our policy and advocacy activities to help paint a fuller picture of our engagement. So now let's get into our budget priorities. For the early learning, we had 3 approved priorities this year, which included early learning rate reform, the waiving or elimination of early family fees, and maintaining 20,000 additional childcare spaces as scheduled. As some of our commissioners may recall, comprehensive reform of California's early learning rate reimbursement system was a top priority for First 5 LA this year and a leading talking point during Advocacy Day last April. Also, in collaboration with our partners from the EC Coalition, we participated in weekly advocacy meetings in Sacramento. Our collective effort was successful because the final budget did dictate resources for moving the state into a single reimbursement system using a cost-based model. Similarly, the 2022-2023 enacted budget committed to prioritizing $20 million in ongoing funded to provide continuous medical eligibility for children under the age of 5 years old, starting in 2025, but also said that the state could assess whether to follow through on this funding depending on economic conditions. Although First 5 LA advocated to the state legislature for of this policy, and lawmakers in fact did feature it in the version of their budget, following the negotiations with the governor, continuous eligibility is no longer funded. However, lawmakers and the administration still could include it in next year's budget. In last year's enacted budget, lawmakers had committed to permanently raise CalWORK's cash grants to half of the federal poverty level, starting in 2025. Again, this would be assessed with current economic conditions and decide whether to follow through on this or not. $50 million from the general fund was allocated to a permanent 10% increase in the maximum aid payment through CalWORKs, and a further investment in fiscal year 23-24 to increase CalWORKs grants by an additional 3.6% goes into effect August 1st, so in a couple of days. October 1st, thank you. Together, this brings CalWORKs cash grants much closer to the 50% federal poverty level threshold desired. Finally, we are monitoring discussions around the renewal of the managed care organization tax. Initially suggested in the January budget proposal, lawmakers and the administration finalized the details of how to spend new funds from the tax on Medi-Cal managed care organizations. Unlike previous state MCO tax regimes, which sent the revenue to general fund accounts, the current tax plan will provide money specific health-related accounts. This year, our team shifted through dozens and dozens of bills and analyzed and tracked a total of 20 bills. Ultimately, 4 of those reached a threshold of support position by First 5 LA. The first 2 bills you see listed on your screen, AB 596 and SB 380, which are put together because they're mirror bills, meaning that they're identical, except that one is going through the assembly process and the other through the Senate. Both bills sought to enact comprehensive reform of California's early learning reimbursement system, so similar to our budget priority. While both bills have turned into 2-year bills, we're not discouraged by this because this means that the proposal still has the potential to become a vehicle for a policy change at a later time. Plus, main provisions of these bills were included in the final items of the budget. AB 1015, a bill that would require the Department of Social Services to administer a statewide diaper and wipe distribution program for low-income families with infant and toddlers under 3, is waiting the governor's signature. This bill would build on the infrastructure of a diaper bank program and allocate grants to specific food banks and regional entities to distribute diapers to low-income families with infant and toddlers. SB 282 would authorize the reimbursement for a maximum of 2 visits that take place on the same day at a single site at a federally qualified health center or rural health clinic, or through a telehealth-based encounter. SB 282 is currently held under submission, meaning that there is no motion for the bill to progress out of committee. On the wait list, a bill to mention is SB 326, which I know there's been a lot of conversations both locally and also at the state level about. Governor Newsom's legislation modernizing the Mental Health and Services Act is currently waiting for the governor's signature. Children's advocates from across the state work to include a prenatal to 5 language in the bill, and we're successful in doing that. On our administrative state policy side of the work, the Rate and Quality Advisory Panel, the UPK Mixed Delivery, Quality and Access Work Group, and the implementation of TK are all tables currently discussing how to improve the state's early learning system. OGAP, along with a lot of our EC colleagues, monitor and participate in these virtual meetings. A priority of the administration advocacy was also the monitoring of the newly introduced Medi-Cal benefits, namely the DOLA implementation work group, which went into effect this past January. The DOLA implementation work group serves as a space to elevate and discuss lessons learned and barriers in the process of implementing this benefit, and includes a variety of stakeholders, including doulas, managed care plan representatives, and health service providers. Medi-Cal for Kids and Teens is a new terminology after DHCS announced a rebranding for the existing early and periodic screening, diagnostic, and treatment benefit as part of the Cal-AIM strategy to support health and opportunity for children and families. We are monitoring the implementation of this rebranding process as part of the broader efforts to support local managed care plans and improving access to screenings and interventions for children below the age of 5. Cal-AIM consists of a series of reforms that aimed at improving outcomes for Californians enrolled in Medi-Cal, especially for those with more complex needs. The implementation of the first Cal-AIM reforms began in January of last year, and further reforms are phased in through 2027. First LA continues to monitor these changes and attends webinars to understand the impact of Cal-AIM on children and families, and to identify opportunities to support local managed care plans in their implementation efforts. Lastly, administered by the California Department of Social Services, the Supplemental Nutrition Assistance Program, or known as CalFresh in California, was significantly reduced in March of this year. The sunsetting of CalFresh emergency allotments during COVID times caused Californians to see a dramatic drop in their food benefits. First LA has monitored these policy changes and is actively looking for state and federal policy opportunities to continue support families by increasing food security. And now I'll turn it over to Anais to guide us through the 2023 federal priorities and the rest of our presentation.
Thank you. Thank you, Velia. Before I start, I want to highlight for our new and newer Board of Commissioners that First Step LA has been building our federal footprint in DC for over the last 10 years. I used to work at the Rabin Group and was one of First Step LA's federal advocates. And I'm proud that I still continue to represent our work. And I'm proud that our work on the federal level has never stopped, especially now with so much at stake. So with that, we do have some immediate updates that are not listed on the PowerPoint because of recent developments. But I'll start with the shutdown, which it looks like it's imminent unless Congress can pass a plan to continue funding the government by this Saturday at midnight, which is when the fiscal year ends. The Senate has passed a bill to continue funding the government through November 17th, but due to the dynamics within House Republicans, they haven't been able to pass a deal together. This would, of course, greatly disrupt the nation, especially for a handful of federal programs that people rely on every day. Most importantly for us, with this fiscal deadline also comes the expiration of the childcare investments that were passed under the American Rescue Plan. We know this will create a huge childcare crisis and impact our economy. It will certainly make a dent in the progress that we've made over the last couple of years, and especially affect low-income families and people of color. In California alone, more than 87,000 children are set to lose childcare, and more than 13,000 childcare programs are expected to close. First Step LA has joined national partners in asking Congress for $16 billion each year to continue extending these funds. As a result, legislation was introduced called the Child Care Stabilization Act, which extends that funding for the next 5 years. OGAP has done outreach to our Los Angeles delegation of members and senators to advocate on the crisis, and we're asking them to support the legislation. We've also signed on to national letters, and we've supported the First Five Network with contacts and templates commissions can use to reach out to their own members as well. We know this funding will potentially expire by this weekend, and so we expect this will continue being an immediate priority for us. While we do have to strategically sequence our work because there are numerous current pressing issues, SNAP or CalFresh in California and WIC are also under threat of being underfunded. The Farm Bill, which holds major SNAP provisions, is up for reauthorization this year, and Congress has an opportunity to increase funding. OGAB wrote an article on the importance of SNAP and food nutrition assistance programs that will use as an advocacy tool as the Farm Bill negotiations continue happening. In regards to the FY24 appropriations package that will set funding levels for the year ahead, the Senate Labor, Health, and Human Services Subcommittee has voted to increase funding by $1 billion over FY23 levels for childcare and early learning programs. However, the preschool development grant would see a $5 million cut. On the House side, they've agreed to level fund the childcare development block grant to $8 billion, which is a good thing. However, they're proposing cuts, and I'm going to say the word slash, because they're slashing many other critical programs. Negotiations are still happening, and they will continue after this potential shutdown gets resolved. And OGAB will be advocating to ensure members are committed to prioritizing allocations for important childcare development programs and services through the rest. So more to come on the federal level, but now we'll transition to discuss the 2024 policy agenda. And we'll start by providing a quick review of the purpose of this document. The policy agenda authorizes First 5LA's policy and advocacy work, informing where First 5LA leads, supports, or does not engage on policy issues. It recognizes the full range of policy changes necessary to achieve desired outcomes, including budget items, legislation, and administrative change. It also guides the organization's public policy analysis and any proposal development we may engage in. Finally, it supports efforts to both advance long-term change and response to short-term needs, issues, and opportunities. 2024 marks the fourth year since First 5LA made the critical shift to focus on equity as a foundation of our policy agenda and our policy work. This was a conscious decision made in response to the social movements following the unjust killings of George Floyd and Breonna Taylor in 2020, and recognizing that structural racism is woven through many of the systems that and institutions that families interact with, which disrupt optimal development and family stability. We prioritize equity in the policy agenda by uplifting the need to close race-based disparities across health, well-being, and opportunity, by utilizing the best available data and advocate for availability of full, complete, and disaggregated data, and promoting a holistic system of supports that is linguistically and culturally responsive. Before we dive into the priority areas of the policy agenda, I do want to preface that we recognize the organization is working on our strategic plan with a revised vision and mission, and so these are subject to change once that process is complete. However, for the purpose of this conversation, we are operating under the existing strategic plan and the priorities that we have currently established. So the 2024 policy agenda advances the following community-informed priority areas. It promotes a comprehensive system of family supports to advance positive outcomes for the whole child and whole family, improves systems to promote the optimal development of children through early identification and supports, expands access to affordable quality early care and education, and ensures communities have the resources and environment that supports optimal development for children prenatal to age 5. Now, looking forward to 2024, OGAB will update the policy agenda to reflect the new strategic plan. This will be done in collaboration with offices and CCFI teams to ensure that the policy agenda aligns with the organization's Ghost framework. We intend to complete the engagement process early in the year and return to the board before the end of the first quarter to present the refined policy agenda for approval. And lastly, to provide you with a clear overview of what to expect next year, here is our projected you see here our projected advocacy roadmap and board engagement. So January 1 is the new state legislative session. It begins on January 1, and typically on or before January 10, the governor will release their proposed state budget. In February, the First Web Association is holding their advocacy day from the 5th to the 7th this year. Tentatively, OGAB is aiming to return that same month to the board to present our new policy agenda. March through May is when legislative committee hearings take place, which, depending on approved priorities, OGAB, with the support of our state lobbyists, California Strategies, will attend and monitor. On or before May 15th, the governor will release his revised budget. So leading up to this point through June, we will be holding advocacy meetings targeting specifically our delegation, our LA delegation, to advance our priorities. Concurrently, budget conference negotiations happened around that time. This all culminates in June, when the legislature will release its budget, typically mid-June, followed by the governor's final state budget at the end of the month. And the last day of the legislative session is some time in August. And finally, September to October, which is where we are now, is when the governor will sign or veto any bills. And that concludes our presentation. Thanks so much for your time. Now we'll open it for anything that's on top of mind for you, or if you have any questions or comments.
Comments, questions? Thank you very much. It was amazing and a little depressing.
Sorry.
Or a lot depressing, but
I definitely brought the darkness today.
are there any public comments?
Confirming there are no public comments on this item.
All right, and can we move on to, I'm not sure how to do item 9. Is it written only?
Item 9 is a written only item. It's to establish a strategic partnership with Health Federation of Philadelphia in the amount of $400,000. Unless commissioners have any comments or questions, we'll move on to just marking this as information and proceed to the next item.
Is there any presentation on this other than?
Confirming there is no presentation on the item, but there was a memo provided to the public and commissioners for their review and reference.
Let's see here. Are there any comments on this written? Any comments from the board? No? All right. If not, I guess, do we need to vote on anything like this?
There is no action on this item. This item will be coming back on the consent for the following month for action. And if there aren't any board comments, I will confirm that there are no public comments on this item.
Thank you. Are there any public comments or board comments on items that aren't on the agenda for today?
If there are no board comments, confirming that there are no general public comments on items that are not on the agenda.
So can we adjourn for the day?
Confirming we may adjourn this meeting.
All right. Thank you all very, very much. Thank you for bringing the darkness. The reality check.
See you. Who said that?